Hi, everybody, and welcome to episode 55 of the Pet Behaviour Chat. So today I want to talk about a topic that's really quite close to my heart, just because I have recently lived with two older doggies, one of whom we sadly lost last year, but I currently still live with one senior dog, our lovely girl Lexi, who's probably about, we're not entirely sure, but we think she's around 11 to 12 now, so definitely in the realms of senior. And so the topic that I want to talk about today is Canine Cognitive Dysfunction Syndrome. So the title kind of is, does doggy dementia exist? And the answer to that obviously is yes. Now, we also do recognize it in cats. And if you tune into episode 57 in a couple of weeks, I'm going to be talking all about cognitive dysfunction in cats as well. But today I want to really focus on our doggies. So what is cognitive dysfunction syndrome? So I've just kind of alluded a little bit to sort of the doggy dementia that it's sometimes referred to. And I guess it can be compared a little bit to sort of human neurodegenerative diseases, because there are some similarities there in terms of how the brain changes as it ages. And it absolutely is that. So canine cognitive dysfunction syndrome is a neurodegenerative disease. And that basically means that it is progressive. It cannot be cured. It can be somewhat slowed down or perhaps protected against, which is probably the best way of looking at it. And it is basically a number of changes that occur in the brain as the brain ages. And with that comes certain changes in behavior and changes in cognitive abilities, changes in learning capacity or the capacity to remember certain things. And we'll kind of talk through those bit by bit. But certainly it's something that we definitely see and recognize. But I have to say it's probably one of the most underdiagnosed and underaddressed and undertreated conditions that is probably out there. Our dogs and our cats are living, on the whole, much, much longer lives because our sort of healthcare, veterinary healthcare is that much better. And I think some reports say that something like 40% of the canine population are actually made up of these senior pets. And the definition of a senior pet is different according to sort of the literature that you read. I think the AAHA say it's the last 25% of a dog's life, so the last quarter of their lives, if you like. Some people sort of define it by years of age. So anything from 8 years of age would be senior, and then it kind of goes up in stages. Certainly dogs, between, I would guess, 11 and 15, or, in that sort of much higher teenage bracket, are potentially called senile or super senile, sometimes they're called. So depending on the sort of different age bracket, and again, this varies a little bit depending on which textbook you read, but we've sort of got different stages of getting older, if you like. But it's certainly recognized that dogs from around the age of 8, and it has been shown in some kind of research settings even younger than that, start to show changes that are I guess, due to aging and due to those degenerative changes in the brain. So just to give you a bit of an idea, so one of the bigger studies that was done in 2001, I believe it was. Yes, it was 2001, I'm right. Looked at, how many dogs of a certain age show degenerative changes. And I think the numbers are something like by age 11 to 12, 28% of dogs have at least one sign. And by age 15 to 16, 68% of dogs have signs of cognitive dysfunction or brain aging or, neurodegeneration. So that's a lot. That's a third of our dogs, if you think about it, a third of dogs by age 11 to 12, and almost 70% of dogs by ages 15 to 16. So you can start to see what a big number this is, and what a huge part of the population this potentially is, and how important it is both for us as dog parents or dog caregivers, but also for us as veterinarians, veterinary nurses, pet care professionals, to really start recognizing some of these changes that start to occur from as early as, like I say, 8, maybe even younger years of age in our doggies. So I mentioned a little bit that it's not a disease that can be cured. So it's something that can only be sort of slowed down or prevented, hopefully. And similarly, it can also be quite difficult to diagnose because we call it a diagnosis of exclusion. So we basically think about excluding all other things that could be contributing to these changes in behavior, such as pain, other physical diseases, maybe changes in mobility, the environment being maybe too difficult for that particular dog to navigate easily, other physical diseases, as I've just mentioned, such as endocrine diseases or hepatic disease, kidney disease, brain pathology, neurological diseases, pain, as I obviously said, a huge one, all other diseases that could be contributing to change in behavior. They all need to be excluded first before we can say it's likely that your dog has canine cognitive dysfunction. And that can sometimes be a little bit difficult. And sometimes we also have overlap there, right? So it's not impossible for a dog to have cognitive dysfunction syndrome and at the same time have osteoarthritis. And we need to then try and sort of weed out, what parts of the behavior are being contributed to through osteoarthritis or pain, and what parts of the behavior are more brain related or more due to cognitive dysfunction. So the diagnosis in itself can be quite challenging, and we always want to make sure that we're looking at the big picture, and we often have, comorbidities or different things going on at the same time. And I think that is what makes sort of geriatric or senior veterinary care both so challenging, but also so very rewarding, because once we've identified those things, we can actually start to treat whatever needs to be treated and to start making those adjustments in the environment, and also using other things to help those dogs along sort of the latter years of their life. Okay, so I've spoken a little bit about those behaviors, the behaviors that we see with cognitive dysfunction, and I want to give you an overview of the types of things that we would often see. So we use a scale that is called the DISHAA scale. Now, there are a couple of other scales, the KD scale, for example, but I think from a clinical point of view, clinically, for ease of use, I think the DISHAA scale is really great. And it's an acronym, and I'll go through the letters in that acronym in a second. And it basically gives us a bit of an idea of what are the things that we should be and could be expecting in our senior pets. All right, so DISHAA is DISHAA, so double A at the end, and we'll start with the letter D. So D stands for disorientation, and this is something that we'll frequently see, and is usually dogs who find orientation within the space quite difficult. So they might get trapped behind doors and not remember how to be able to get out, or they might get stuck in front of a door and not know how to sort of navigate that. I've seen dogs that have stood in front of sort of glass patio doors and have found it difficult to understand why there's no exit there now, because the doors are closed, but they can still see through those doors. But I think the classical thing is getting stuck in corners and finding it difficult to navigate their way back out of a corner. Sometimes we can also have staring at walls or staring into space, or walking sort of into a wall and then just standing there and then not knowing quite how to sort of maneuver away from that. So that would be the disorientation piece. So that's the D. The I stands for interactions, and we're talking about social interactions here. And they can be either increased or decreased. So it can go either way on the scale. And we're talking about interactions both with their human caregivers, but also perhaps with other pets in the home. And so it could be that we see dogs that are perhaps more interactive or more clingy. A lot of people sort of use that word clingy. because they're sort of stuck to their caregivers more now. They're following them around more. And that could also be due to increased anxiety or insecurity. We've maybe got some sensory decline. Maybe they can't see as well or hear as well anymore. And that causes that insecurity. And we see that change in interactions with their people. On the other end of the spectrum, it could also mean decreased social interactions. So taking themselves off somewhere, perhaps being solitary more, sleeping or resting for longer periods of time, and not being as interactive with the humans in the family. And then altered social interactions with other pets in the home could also be either they don't maybe recognize those pets anymore, they don't recognize them as part of their sort of family circle. You could get some strained interactions. You could get maybe the older dog being more irritable, maybe because they're painful. And then we could have some agonistic interactions with other dogs or maybe cats in the home. So changes in social interactions are really, really important to note here. And they're often the sorts of things that are quite subtle to change and might be difficult to notice, but we definitely want to be asking about interactions. So that's the I. Then we move on to the S, which stands for sleep-wake cycle. So oftentimes in these senior pets and senior pets with canine cognitive dysfunction, we'll see changes in sleep-wake cycle. So they will either be sleeping more or potentially less, or their rhythms of sleep might change. So we might have activity in the night. That's very common. So that all of a sudden the pets aren't sleeping through the night anymore, and they're getting up in the night and perhaps pacing or, getting stuck somewhere, that disorientation piece. So that's quite a common presentation there. We could have them sleeping more. So that's something that could be perhaps within the scope of normal for an older animal. Sleeping more. But definitely the changes in the patterns, I think, are important. So, they perhaps don't follow the same routine that they did. And especially that nighttime waking piece is important there. Then comes the H of the DISHAA scale. So H would be house soiling. So oftentimes we will see dogs that soil in the house, and that could be either because of loss of learning. So they have kind of forgotten about their house training. They've forgotten how to signal that they need to go out. They've just kind of forgotten that outside or, their usual elimination spot is the right place to do it. That could also be related to pain. So again, you start to see where some of these things overlap. It could be that the dog just isn't comfortable making perhaps the long way outdoors. Maybe they have to go down some steps, or maybe some steep steps to the outside, and they find that uncomfortable. And so it becomes actually much easier and more comfortable to actually just toilet in the home. So loss of learning, pain, and then some other diseases such as endocrine diseases can cause house soiling as well. So, if we're looking at things like kidney disease or diabetes or perhaps Cushing's disease, anywhere where we have an animal that's drinking more and therefore also urinating more, that can also contribute to house soiling. So again, you start to see where the canine cognitive dysfunction and other physical health challenges that occur frequently in older pets, where they start to overlap and where we need to start sort of pulling these apart to make sure that we're not missing a medical presentation and we're putting everything down to canine cognitive dysfunction, but actually the dog maybe has the beginnings of renal failure, and that's why we're seeing house soiling. So really important to always look at that bigger picture. Okay, then we've got the A, so DISH, we've got two A's. The first one would be activity levels. So again, this can go either way, and that's, again, sometimes the challenge of interpreting some of these things. So you could see decreased activity, so dogs that just are not as active as they used to be, that slow down on walks, that maybe don't want to go for as long a walk, just have very much reduced play activity in general. And again, we have to think about, is it only cognitive dysfunction that's causing that, or could we have pain as a contributor there as well? So that's an important piece to think about. But we could also have increased activity, and that often comes with this pacing and panting that we sometimes see in older pets. And yes, that could be down to cognitive dysfunction, But again, we're thinking about pain. So oftentimes dogs that are in chronic pain, yes, they might have reduced activity, or they may show that by pacing, being unable to settle, shifting. They might be more comfortable standing, and then they pace. They find it hard to settle. They might find lying down difficult, or they might then need to get back up again and shift weight around. So again, changes in those activity levels, whether that's reduced activity or increased activity. But I guess important is that there's a change. There's a noticeable change, and the pet caregivers noticed that, or you as the pet parent have noticed that, and that's something that we need to then investigate further. And then the final A in DISHAA is anxiety. So anxiety often also goes hand in hand with getting older. And yes, that might be due to neurodegeneration in the brain, but could also be due to other things like I just mentioned, such as sensory decline. So maybe sight getting worse or hearing getting worse, and the dog's just not being as confident, a loss in confidence. We often see separation anxiety appear in these older dogs. They become, like I say, quite clingy, that sort of word that we hear from caregivers a lot. And separation anxiety is something that we can see with increased frequency in older dogs. And yes, can be an effect of the cognitive dysfunction syndrome, but could also be as a secondary effect to other things such as sensory decline or pain, for example. So again, lots of potential overlaps here. So you can't see it in isolation, but we always have to remember that the brain is changing, and I will perhaps go into a little bit of what those brain changes might be. And with that come differences in cognitive capacities, in learned behaviors, forgetting learned behaviors or finding it harder to learn new behaviors, all that sort of thing. But we always have to be on the lookout for what else could be going on there. So one other thing, and kind of going on a little bit from this. So I'm going to talk in a couple of weeks in episode 57, I'm going to talk about cognitive dysfunction in cats, as I mentioned. And cats also have their own scale, which I'm going to go through in that episode. But at the end of that scale, there's an L. So it would be DISHAA with an L at the end. And L stands for learning. And that's a little bit what I've just spoken about. So finding it harder to learn new things, slowing down perhaps on some cognitive tasks, and forgetting some previously learned behaviors. So that learning piece is also quite important there. And that's potentially due to changes in neurotransmitter systems in the brain. And I will just briefly touch on these a little bit so that we just have a bit of an idea what actually is happening in the brain, that is, what are these changes that are happening in the brain. So the first thing would be what we refer to as brain atrophy and neuronal loss. So the brain matter actually shrinks. And with that, we get increased ventricular size. So brain matter shrinks, but we get these bigger ventricles. So that would be one thing that changes. We can also see vascular pathology. So we can see kind of microhemorrhages and microinfarcts in the brain. We might have other sort of cardiovascular pathology going on. So we might have hypertension, we might have renal disease, we might have cardiac disease, and that might contribute to changes in the brain. That might, again, cause hemorrhages or infarcts, or perhaps not enough blood being supplied to the brain. So again, we see the changes in the brain, but there could also be links to other parts of the body. And then we talk about our neurotransmitter systems. And one of the neurotransmitters that does become altered is the anticholinergic system. So we get a loss of cholinergic neurons, which are neurons that their neurotransmitter is acetylcholine. And acetylcholine is very much responsible for learning and memory. And that's one of the systems that we also see that depletes with Alzheimer's disease. And actually, some of the drugs that are used for Alzheimer's disease actually target this particular neurotransmitter system. So we'll have choline esterases, for example, that are used to treat that in humans. And I think there are also some reports in dogs of some clinicians using those, although that they're not yet widely used, but something to think about for the future for sure. And then the other neurotransmitter system that we think about with this is the dopamine system. So we'll have decreased dopaminergic function. And again, dopamine, as we know, is responsible for a number of things, including motor activity, so movement, but also learning and memory, also mood, So lots of things there that can also impact how our older patients feel as these brain changes start to occur. And then we've got other things that happen. So we might have increased inflammation. So that's something that definitely is talked about a lot. And then we have a couple of very sort of specific changes. One of them is beta amyloid plaques, which is also seen in humans. So we see these plaques in the brain. And then we also see tau pathology. That's a specific protein in the brain. And we can see these hyperphosphorylated tau systems and neurofibrillary tangles. So these are specific types of pathology that are not only seen in dogs, but also in humans that are thought to be responsible for dementia, Alzheimer's disease, and these kind of neuropathological changes. So that's a little bit what we're talking about when we talk about brain changes. And, you know, what we see as clinicians are the changes in behavior, as I just mentioned with that DISHAA scale. But that's what we would see if we did an MRI of the brain. You know, if we did some fancy imaging, we would start to see these changes in the brain. Okay, so we probably need to talk a little bit about what can we do. So as I mentioned, it's not something that we can cure, same as in humans. It is something that is degenerative and ongoing. What we can try to do is affect some of the systems that we've just spoken about, and also try to slow down the progression of the degeneration. And I guess we've got a couple of things that we have in our toolbox. If I talk about medications first and foremost, we have a medication that can affect the dopamine system, and that is a medication called selegiline. It's a monoamine oxidase inhibitor. I always get that word wrong. Monoamine oxidase inhibitor. And it basically stops, in particular, dopamine from being broken down. So we have more dopamine available in the brain. So that's a medication that we can use, and there has been research done on it, and it's actually a licensed medication, Anipril, I think it's called, in the US and in Europe for canine cognitive dysfunction. So it's a licensed medication. I guess it's not used super commonly because there are quite a lot of contraindications to consider, and it can't be used together with some other medications. So it's a medication that needs to be used carefully and wisely, and the person using or prescribing the medication needs to know that medication very well and needs to make sure the dog is not taking any other medications that could be a problem, and needs to know that quite well. A second medication that I have used quite a lot in the past is a medication called propentophyline, which is known under the trade name Vivitonin. And that increases the microcirculation in the brain. So it kind of targets that vascular pathology in the brain. So the idea is to improve the microcirculation to get more oxygen to the brain. So I think that's something that could definitely be looked at. And then, as I mentioned, influencing that acetylcholine system. So I just touched on it earlier, those choline esterase inhibitors, for example. So they're medications that cause more acetylcholine to be available in the brain. So that could be something. As I say, it's used more commonly in humans. There are reports and there is talk about using it in pets, in dogs, but it's not, I guess, something that would be massively commonly used, and again, would need to be used by an experienced clinician who understands the medication quite well. So those are sort of, I guess, our main medications. I don't think I've forgotten anything there. Obviously, if we have other things going on, such as pain or anxiety, we might want to use other medications as well, but I guess they would be targeting less the cognitive dysfunction or that brain degeneration, and rather they would be targeting other signs that we start to see with old age, such as anxiety, such as chronic pain, and other things that might be going on. And there's one other medication from our sort of range of psychopharmaceuticals that I quite like using in these older patients, especially if I don't want to go for selegiline, and that is sertraline. So it sounds similar to selegiline, so you have to be a little bit careful. But sertraline is actually an SSRI. And the reason I quite like that in these cases is because it has a dopaminergic action as well. So it does increase the levels of dopamine, probably not to the same degree as selegiline does, but a little bit. And sertraline can be quite a nice anxiolytic. It has seems to have relatively few side effects, or the side effects seem to be milder than with other SSRIs, such as fluoxetine, for example. But sertraline is definitely something that I think about in my older patients where maybe I don't want to go for selegiline, or I can't use selegiline because there's another contraindication to doing that. So I think that's a little bit kind of the medication piece. And then we have a whole bunch of supplements and diets that we can use in cognitive dysfunction syndrome. So what we're trying to do basically is reduce inflammation. We want some free radical scavengers. We want supplements that help to stabilize the membranes, cell membranes. We want to try and mop up some of these free radicals that perhaps are being created by increased oxygen breakdown, for example. And as I mentioned, we want to try and reduce inflammation overall. So there are a number of different supplements on the market that have various combinations of factors that do these. So we can use vitamins, we can use flavonoids, we can use other kind of membrane stabilizers. And some of them, I'm just going to mention some of them here. So SAMe, S-adenosine methyl something, I can never remember it, but so SAMe, S-A-M-E, and that comes in a supplement either called Denamarin or Samolin we have here. So that could be quite a good option. We have another supplement called Activate, A-K-T-I-V-A-I-T, Activate. That comes in a canine and a feline form. And that's something that could be contains different active ingredients or different supplements within the supplement, if you like, that have different actions. Senilife is one that's very popular in the US, for example. Also contains a mixture. I think Senilife contains ginkgo biloba as well. So another type of active ingredient that is good for, I guess, good for sort of things, not brain pathology, but good for supporting healthy brain activity, if you like, or healthy brain function. So lots of different supplements that do different things. And then we have diets. So one diet that I think has been really widely used is the Hills BD diet. So that's brain diet, BD. And again, contains various different ingredients that kind of act in the ways that I've just mentioned. So that's something that can be used. And then the other big one that's come out quite recently is the Purinaproplan NeuroCare. And the kind of interesting thing about that is it contains MCTs, so medium chain triglycerides, that offer a different energy source for the brain. So the brain no longer has to rely on glucose, but actually can use ketones as an energy source. And that seems to be something that is beneficial in canine cognitive dysfunction. So we've got a couple of diets. There are a few others which I'm not hugely familiar with because they're mainly US based, but there are some of the senior diets that have some of these active ingredients. I'm most familiar with the Hills BD and the Purina NeuroCare diet. So I'm just going to mention these more, but there are others that potentially have some of these benefits as well. So supplements and diets, I think, are two really big things. And obviously in an older dog, we always have to be careful with different medications influencing each other. And we, I guess, are less fearful of that if we're using a supplement, although we always have to check the active ingredients or the ingredients to make sure that we don't have any adverse effects with medications interacting with each other. So that would be the medications, the supplements, and the diets. And then we need to talk about managing the environment, and also behavior modification and enrichment. So management of the environment for an older pet is often to do with making things a little bit easier for them, getting into and out of the car, getting onto and off of preferred resting places, having very comfortable padded thick beds, for example, making sure that access to the outdoors to be able to toilet and eliminate is as easy as possible. I know many people who have built temporary ramps for their dogs to kind of be able to more easily access the outdoors. if you have slippery floors, if you've got hardwood floors or tiled floors, you want to consider putting down mats, yoga mats, non-slip surfaces, more rugs to help them in their mobility. You can use things such as scent boxes, for example, or typical or different types of scents to indicate to a dog that they're in a certain place. So if we're getting a little bit of sensory loss, if they perhaps can't see or hear as well, they might still be able to smell. And you could, for example, have a lavender smell in the kitchen, which then signals to the dog, this is the kitchen. Or you could have a different smell again at the door that goes outside, or that depicts different rooms in the home. So some of these sort of environmental considerations, I think, can be really useful and can also reassure the dogs if they're starting to feel a little bit unconfident in their environment and their surroundings. So I always want to urge everybody to think about that. Don't just think about medication, supplements, all those things. Think about what you can also do in the environment to help your dogs. So when my dog Polly, when she was getting older, I say my dog, she wasn't really my dog, she was my husband's dog. She was our dog. As she was getting a lot older, we helped her out a lot. For example, at the food bowl, we put a non-slip mat down in front of the food bowl because we could see that she was struggling to access the food bowl without her front paws kind of slipping a little bit. We then raised the food bowl with the non-slip mat, and that made life so much easier for her. So just small things like that really, I think, made a big difference. We also put non-slip patches or stickers on the stairs. So that made it a lot easier for her to go, especially downstairs. I think she found that security, that grip very, very comforting. So little things like that, I think, are really important when we think about our senior doggies. And then obviously behavior modification, for want of a better word, training, or giving them puzzles to solve, actually challenging their cognitive abilities a little bit, that whole adage of use it or lose it. So we want to make sure that we don't just think, they're too old now, they don't want to engage in some very, very simple tricks or tasks that maybe they learn. And I'm not suggesting we do lie down and roll over with an older dog, but a nose target, or helping them to use their cognitive abilities. So you could have 3 little cups with a treat underneath one, and the dog has to work out which cup the treat is under. Or using things like food puzzle toys, very simple ones potentially at first, to just help them engage that cognitive part of their brain, and to help some of those neuronal connections stay stronger. And that's where we have that kind of prevention, I guess, of the cognitive decline. So, I think those little things are really, really important, just super easy things. And it keeps that relationship going between the caregiver and the dog as well. It's just another way of them being able to bond and keep that human-animal bond alive. So that's a little bit like the, tricks, training, behavior modification, getting them to do things. And then my final piece is enrichment. And you'll have heard myself, that's next week's episode. Sorry. Next week's episode, Ilse and myself talk about enrichment and behavioral diversity. So tune into that episode if you want to hear a little bit more about our thoughts on enrichment. But we want to make sure that we are making our older doggies' worlds as behaviorally diverse as we can, so that we still continue to meet their behavioral needs, and that we still continue to give them enrichment and stimulation. It might look different than it would to a younger dog. A younger dog might want to play and leap about and tug a toy and all those sorts of things. An older dog, it will look different, but they still need that mental enrichment, that mental stimulation. And that absolutely can be done with things like food puzzle toys, or the scents that I mentioned just earlier, having different smells, giving them scent boxes. Again, tune into next week's episode to find out about that. Allowing them do really sort of short, slow walks, but allow them to sniff as much as they want to on their walks to really get that sensory stimulation. And that really is also really good for their brain health. So I think it's really important to think about those things. And then, of course, we want to provide lots of social enrichment, social reassurance, especially if those social interactions are challenged, as I mentioned at the beginning when we went through our DISHAA scale. So lots of things to think about when we think about our older pets. And obviously it's important, again, just to summarize, it's important that we consider in our diagnosis whether we have canine cognitive dysfunction, what stage it is at. And that DISHAA sheet has a really lovely sort of scoring system in there, so you can figure out what stage they're at, whether it's mild, moderate, or severe. And I would always recommend to repeat that DISHAA score every 6 months, just to see whether there's been a progression or whether we've been able to kind of halt things a little bit. And I think that's really useful for everybody to see, whether you're a vet or a caregiver, a vet nurse, right? That's going to really, really be helpful. So getting the diagnosis, but also making sure that we don't miss any adjunctive diagnoses, such as other physical diseases, in particular pain. We need to be aware of what's going on in the brain. We need to understand that we can't cure it. We can just slow things down a little bit. And we definitely want to think about prevention. And yeah, when we come to sort of treating it, we have quite a few things that we can do. And it's really important that we don't rely just on medication, supplements, diets. Actually, pheromones is one thing I forgot to mention. So Adaptil would be a good thing here as well. But that we also think about the environment and how we can continue to stimulate their lives as they get older. So I think those points are all really important. So next week, you're going to have the enrichment and behavioral diversity episode. And then the week after that, I'm going to speak about cognitive dysfunction in cats. And I might talk a little bit more in that episode about how we can prevent cognitive dysfunction from setting in even earlier. What are the things that we think contribute to either, a fast decline or a slower decline in cognitive function? So tune into that if you want to hear the kitty cat version of this. It's slightly different. A lot of it is quite similar to dogs, but there are some specifics for cats that we need to really think about. They also present slightly differently, so I'll be talking all about that. And we'll talk a little bit more about prevention and what are other things that can influence brain health and that can prevent that cognitive dysfunction from setting in early or from declining very rapidly. So I hope you enjoyed this episode. I love talking about our senior pets. I think it's so important that we give them as good a quality of life as we can towards their sort of twilight years. So I hope you enjoyed it. I hope you got something from it. And please leave me a comment if you have any questions. And I look forward to seeing you all in next week's episode. Bye for now.